Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today's Incident Command Day 53, providing you the update from Albany Med on the coronavirus. In the 5 counties, we are reporting 2,306 people have tested positive for COVID-19. That's about a 3% increase from yesterday. Inside here in the medical center, we have 53 patients that we're currently treating for COVID-19. We have 23 on the floor, we have 21 in the ICU, and we have 6 on ventilators. That is a number which is down from yesterday.
Yes, Dennis, the number inside the house is down, and it's down in the region as well.
Down in the region as well. We want to provide some update from pharmacy. Let me begin by saying that last night we had another one of our journal clubs. We mentioned this last week. They're virtual journal clubs, and there are articles that are selected where we review the literature and we understand what the most recent recommendations are coming out from academic journals on how to advance care. And this journal club, like last week's, was about COVID-19. In addition to that, we have a pharmacy and therapeutics committee here, which is made up of physicians and pharmacists, infectious disease doctors, and they're making recommendations about how best to treat patients with COVID-19. This is the same group, Fred, that makes recommendations about other types of medical conditions as well.
They do.
So they've most recently come out with new guidance inside here from the medical center, based on literature, also based on studies from the NIH, and looking at what are best practices in other academic institutions. So Fred, let's begin. Azithromycin is an antibiotic we've been using for a while. There was a recommendation on azithromycin.
So azithromycin is no longer recommended to be used in COVID-positive patients. Doesn't seem to make a difference, so that's been dropped off.
So for patients who have received azithromycin in the past, were they adversely impacted by that?
They were not adversely impacted.
Okay,
no.
so it's not longer recommended.
Didn't harm them, it just didn't make a difference in terms of their infections.
Second drug would be hydroxychloroquine. Was there any recommendation specifically about that drug?
So I think the recommendation is to use it a little less aggressively, so only in the inpatient setting for 10 days and not as an outpatient.
One of the side effects of this medication is what they call the prolongation of QTc. And you and I understand that. You're a cardiologist. Explain what that is and why we monitor that.
So it's a measurement on your cardiogram, and sometimes if that gets too prolonged, it predisposes you to a rapid heart rhythm. That can make you faint, or if it's really bad, can actually be fatal.
So when we're using this medication on the inpatient setting, we're always monitoring patients.
Very carefully monitoring and looking at that measurement, absolutely.
So we'll still continue to use it for 10-day periods.
That's right.
Okay. The last drug is something called remdesivir. We've spoken about that in the past, and I believe there's been some recent recommendations that have been put out about remdesivir.
So a fairly large study was actually reported by Dr. Fauci last night in their update from the White House. And what remdesivir seems to do is it shortens the recovery period from 15 days to 11 days. It very modestly changed the mortality. It probably wasn't powered to really tell us whether it reduces mortality, but it definitely shortens the recovery period.
We think that in the future, if this gets more approval, we'll be using that more frequently here?
I think it's going to be fast-tracked by the FDA and be approved for general use in COVID patients very quickly, I would imagine.
So thank you to all the people who work on our pharmacy and therapeutics team. I think it's an important example of how we continually look at the literature and try to advance the practice of medicine based on the most current recommendations. So today we're wearing white coats, and we're wearing white coats because today what we're representing is the health care of this entire region. As I mentioned the other day, we were waiting for some directives to come out on an executive order from the governor. So the directive did come out. Here's the executive order. If you'll hold that for 1 second, Fred. And here's the directive. And the directive is called the COVID-19 Directive regarding the resumption of elective outpatient surgeries and procedures in general hospitals, in counties and facilities without a significant risk of COVID-19 surge. Thank you. So let's talk about that. Let's begin by looking at the word elective procedures. I think this is sometimes a bit of a misnomer and confuses people. We're really talking about the resumption of what I call medically necessary care. Fred, would you care to elaborate?
Absolutely, Dennis. So things like thyroid surgery, if you have a nodule that's potentially cancerous, colonoscopies looking for colon cancer, breast surgery for lumps that, again, may well be cancerous or are cancerous. So we're not talking about cosmetic surgery in terms of elective. We're talking about needed surgeries that perhaps have been put off and can be put off for a little while, but ultimately need to be done.
And as we had talked about, these are procedures, in many cases, that have now been put onto a pause for the last 7 weeks. And this guidance document, this directive that was just put out, talks about how hospitals can begin to do that again. There's a lot of specifics in that. Fred, you've been at the center of this. Why don't you walk us through the key points in that directive? So
first of all, there's criteria for a county. So a county must have at least 30% available capacity in inpatient beds and 30% capacity for critical care beds. So those are 2 of the criteria. The third criteria is to not have had more than 10 increase in admissions during a 10-day period from April 17th to April 27th.
Can I ask you about that? So if you had 50 patients in the hospital with COVID-19,
yes,
10 days later you could have no more than 59 in the hospital.
Correct. That's our understanding, and we've had a conversation with someone out of the governor's office to try to understand that. Then there's criteria for the hospital. And so the same criteria applies for a hospital in a county. So 30% or more capacity for standard patients, 30% or more capacity for ICU, and not to have had a rise greater than 9 inpatients over a 10-day period, as mentioned. And if you meet those criteria, then there are a number of things that also kick in. So you need to have a group that sort of approves or not cases that are going to be done. There needs to be a surgeon, an anesthesiologist, and a nurse from the operating room that are part of that decision-making group. All patients who are going to have elective surgery need to be tested for COVID. That has to happen within 3 days of their procedure, and they have to be negative. Social distancing still needs to happen within the institution, so that's something that's very important, both inside the institution and publicly. And finally, the institution needs to have enough PPE to provide care not only for those patients that are having those procedures, but for the rest of the patients in the hospital. So those all need to be met.
As we had mentioned, we're wearing the white coats today because we're representing the healthcare for the region. Fred and I see this as an advocacy issue for people not only in this hospital, in this county, but the whole region. We take COVID-19 very seriously. I think there's no question about that. We care for these patients every single day, and we know that we're going to continue to do so. But increasingly, we're trying very hard to advocate for the other medically necessary procedures out there. We talk about the 5 counties each day: Albany, Schenectady, Rensselaer, Saratoga, and Columbia. But in our region, we also include Warren County and Greene and Fulton and Montgomery. We coordinate care as a region, not by any individual county.
That's true, Dennis. We really do work as a system in providing care for patients from all of those counties. People flow from Saratoga down here, from Schenectady here, from Warren to Saratoga, etc. People move around within the region you described.
You mentioned those were the criteria published in the directive. There's a waiver process in that directive for counties, for hospitals in those counties who believe that they should be able to start again. The waiver process is something that we would be applying for if we thought we met the criteria. Do you think we meet the criteria?
Dennis, we meet the criteria.
Okay.
I strongly believe that we can provide care for COVID patients, as we currently are, and begin to provide care for those patients who need those medically necessary procedures.
All right. Very important topic. We'll obviously continue to talk about this every single day going forward, and we'll give you updates as we go through the application process for the waiver. I think there was an article in the paper today.
Yes, Dennis. Actually, there was a very nice article in the Schenectady Gazette. They actually spoke to one of our patient support associates, PSAs, Justina Sina. She worked for us for 15 years, and she actually works on C4, which is one of our COVID units. Tell us what she said.
So it was a wonderful article. I encourage all of our workforce to read it. I reached out to her nurse manager, Jen Miller, who said that she's an incredible employee. She's so proud of her. C4, you will recall, is one of the units that is taking care of our COVID-19 population. In point of fact, it was the unit that took a lot of transfers from New York City. And there was a quote in the article that I want to read, so forgive me while I look down, but I think it speaks to this individual's spirit. She says, "I was never nervous coming to work. Even when they brought that first patient, I was in contact with that patient on the first night. I was right there when they took that patient in." She said, "The only time I get scared is when I watch the news, but coming to the floor is different than the news. I see them every day. I talk to them every day, so it's different." So I think it speaks to her spirit, her courage, her willingness to take care of this population. I just wanted to share that. We wanted to share that because we're so proud of her.
It makes me incredibly proud.
Yeah,
Very
for sure.
much so.
So we can't end better than that. We'll end on that.
We can't.
Yeah. So,
But I did receive an interesting text message yesterday that I want to share with you.
okay.
So it's from Helen Lucy.
Oh, yes, Helen.
Helen Lucy is, I think, a 50-year employee.
She is.
She said it's not the mustache. She said, "I'm just cool."
All right, well, we'll end on that because that's also great and also true. All right, very good. We'll be back again tomorrow. It'll be Friday. Once again, that we ask you please take care of yourself, take care of each other, and we'll see you tomorrow.